Deep inside your ankle, a hidden battle is raging. When edema strikes, excess fluid floods tissues, creating pressure that disrupts the delicate cellular ecosystem your body depends on. Fibroblasts, the master builders of connective tissue, become trapped and dysfunctional, unable to lay down organized collagen. Synoviocytes struggle to maintain healthy synovial fluid, so joints lose lubrication and glide poorly. Tiny blood vessels constrict under pressure, starving cells of oxygen and nutrients. This cellular chaos is what translates into the pain, stiffness, and swelling you feel every day. But what if there were a way to restore order at the microscopic level? M.I.B therapy works by applying precise manual pressure to create strategic shifts in the extracellular space. Watch skilled hands mobilize trapped fluid, gently changing local pressure gradients and pushing excess fluid back into the circulation where it belongs. That pressure release reawakens dormant fibroblasts, allowing organized tissue remodeling to resume. Angiogenesis follows. New capillaries form to nourish the repair, and synovial fluid density improves, restoring joint lubrication. The result is rapid pain relief within hours and longer-lasting improvement as the body's natural regenerative response takes over. Through targeted fluid drainage, cellular activation, and improved circulation, M.I.B therapy transforms ankle dysfunction into restored mobility and comfort, cell by cell.